And recording.
Are you going to put it in the presentation mode?
Oh my gosh, I should probably do that, huh? All right, there we go.
Sweet. All right, we good?
Yep.
All right. This is our group project that we are doing. We wrote about type 2 diabetes. And our client, her name is Miss Harvey. Miss Harvey is 52 years old and 150 pounds. Her activity level, like per week and month, we considered it to be minimal. Now, because of this, she has a condition called type 2 diabetes. And so because she has adult onset diabetes, implying her lifestyle choices are what ended up leading her down this path. Type 2 diabetes affects the way the body processes sugar or glucose in the blood. And this particular type of diabetes is caused by the development of insulin resistance in the body. Symptoms of type 2 diabetes include increased thirst, increased urination, hunger, and fatigue during exercise. And the lifestyle that she leads, so like her activity level is minimal. She walks her dog for 30 minutes around her neighborhood twice a week at a relatively slow pace, nothing strenuous or brisk. And then during the rest of her day, she is likely just sitting at her desk or kitchen table doing work, since everyone's working from home now, and walking around the house doing chores like laundry and all that. That's the extent of her physical activity at home. Because she doesn't really get out, she eats very poorly. Describes eating twice a day and how she doesn't really pay attention to the quality of food that she's eating. So she's eating a lot of processed food. Her meals consist of unbalanced fast food or quick and simple microwave dinners. And the reason that she likely developed type 2 diabetes is because foods found in these meals often contain processed meats that are highly associated with her condition. So things like hot dogs, bacon, deli meats, they lead to type 2 diabetes because of the high levels of sodium and nitrates.
Okay, so for treatment options, obviously the basic one is just keeping a healthy diet, because that will help her with her glucose levels and everything. Also, what's obviously obvious is having an appropriate exercise program, because a healthier exercise program will make your body a lot better. You need to take medicine to help with your glucose and all the levels. And insulin therapy is also very important for people with type 2 diabetes. And then the effects of exercise. Exercise can improve your glucose levels and the control of them. It reduces the risk factors of cardiovascular diseases. It contributes to weight loss. It can improve your overall well-being, and regular exercise can prevent or delay development of your type 2 diabetes.
So when it comes to exercise testing, this stage is like really important for this client, because a lot of the risks of type 2 diabetes correlate with heart issues and cardiac events. And so if this client is going to be exercising regularly at above 60% of their heart rate max, that puts them at a way higher risk of a cardiac event. And so depending on how bad this client's symptoms have been, and how developed the diabetes is, you may need medical clearance for this type of testing. But with any client, you want an ECG monitored exercise test, and it's going to be similar to like a Wingate test or like a test of aerobic fitness, where it's going to be a gradual increase of intensity at certain increments, and you're just going to want to monitor the heart rate and the trends of that heart rate, and also the electric trends of your heart as well with the ECG. And then for exercise prescription, once we get that test done and see where this client's at, we always want to include a 5 to 10 minute warm up. And again, that's just because of the higher risk of cardiac events. So we want to get our heart like ready for that, so we don't kind of shock it. And then with the FIT principle, we go through frequency, intensity, time, and type. Frequency, there's a lot of leeway, and it again just kind of depends on how developed the diabetes is and how bad it is. But anywhere from 3 to 7 times per week is ideal. Intensity, we don't want to go above 80% heart rate max. So we want to keep it in that moderate range of 50 to 80%. Time, what is recommended is 20 to 60 minutes per day. And again, that's 3 to 7 times per week. And it actually is shown that it doesn't need to be 20 to 60 minutes like in a row continuous. It can be split up into like 20-minute intervals. And so that just kind of makes it easier for this client, especially since Mrs. Harvey is not really too experienced in exercise right now. That's going to make it easier for her. So just kind of making sure that she knows that it's not that big chunk of time, so she won't get overwhelmed. And then type, it'll be low impact activities. This will make it easier on her joints and her circulation of blood. But just water aerobics, walking, exercises that keep you low to the ground, things like that. And then we want to make sure that they're regulating their blood glucose levels like directly after exercise, to make sure that they don't need to intervene with any insulin or anything like that, because those levels do kind of fluctuate a lot after exercise.
As far as the nutrition advice I would give to this client, water is a huge factor as far as including this in her diet, because she needs to make sure she's drinking water not only to stay hydrated, but it also is a good filler, so she's not feeling like she's hungry all the time and feeling like she has to snack on something that's most likely not healthy. Limiting sodium intake is another one, because this is a huge factor that can lead to poor outcomes such as hypertension, heart attack, stroke, and some of those. Cholesterol, 300 milligrams per day should be the max. And the reasoning for this is because you don't want the LDL to raise, otherwise that'll block the arteries. And since she's already diabetic, you want to make sure you lower this. Fiber is another one that should be increased. She wants to make sure she's getting enough of foods such as beans and nuts to balance her diet. And caloric deficit, this is something that she can take into mind if she wants to become healthier as far as her diet and including physical activity. She can lower the amount of calories she's consuming, and that will help with her balance. And also make sure that she's getting the protein, vegetables, fruits, dairies, all the different categories of foods. And then omega-3s are another one that she wants to make sure she includes as far as reducing the risk of different diseases as far as her health, and then keeping her levels with glucose and stuff good too. Another thing that she can do is create a meal plan or meal prep. Since she's at a desk all day, she can keep track of what is being consumed by creating a chart and writing down something. That way she can see for herself every time she eats something and kind of know in the back of her mind that this is or isn't what she should be doing. And it also creates a motivation for a healthy lifestyle, because she can see right in front of her what she's eating and what she needs to do better. And it also helps track the progress. She could also meal prep ahead of time, which then she just has to throw something in the microwave, and she doesn't have, it's the same as grabbing a bag of chips or something. Substitutes, she can substitute a healthy option for a junk food when able to, and this doesn't mean completely cutting out everything she likes, but maybe finding a fruit like grapes and then having that instead of chips, and just keeping that in mind. It helps create awareness of what she's consuming, and this also helps with progression rather than sudden change, because sudden change will most likely not help in the long term, whereas slower progression will eventually be easier to change habits and then stick with them. And then the summary, she should just make sure she includes physical activity in her daily routine more than she is right now. And those include low impact activities, 3 to 7 days a week to help monitor her glucose levels. And then if she does decide to be consistent and want to change her lifestyle, she should talk with her physician and know whether or not she should be exercise testing. And then nutrition, make sure she's getting a balance with food and limiting her processed foods, because that helps limit the sodium intake and it's more beneficial with the nutrients that her body needs. Okay, sorry, my washer just like made this buzzing noise. But yeah, so that's the main summary of it. And then our references.